This is Plant-Based Briefing, The Overlooked Importance of Behavior Change in Health and Wellness by Dr. Dean Sherzai at thebraindocs.com. And I'm Marian Erickson, host of this curated content plant-based podcast, where I get permission and narrate a variety of articles on plant-based and vegan living in about 10 minutes or less every weekday. And I am super excited to have permission to share content from a new source, thebraindocs.com, which is the website by Drs. Ayesha and Dean Sherzai. They're co-directors of the Alzheimer's prevention program at Loma Linda University. They're both practicing neurologists, scientists, authors, parents, and a husband and wife duo that know the value of healthy lifestyle choices. And they've seen the impact that their NEURO Plan framework has in making the sick healthy and in taking healthy to the next level. They met as young physicians and in their first conversation learned that both of their grandparents had spent the remaining days on this earth suffering from dementia. They vowed to do whatever they could to help others avoid this fate and build healthy minds and bodies. They conduct research, treat patients, and serve as professors at Georgetown University, Columbia University, the National Institutes of Health, Mount Sinai, and Loma Linda University, where they serve as the co-directors of the Alzheimer's prevention program. They've worked with devastatingly disease-ridden populations and some of the healthiest people in the world, the Loma Linda Seventh-day Adventist population, which is a Blue Zone community defined by living measurably longer and healthier lives due to optimal nutrition, exercise, stress management, and social support. And they also have amazing resources on their website. They have brain healthy recipes, a link to their podcast, the Brain Health Revolution podcast, their book, The 30-Day Alzheimer's Solution, which has simple, practical tools and methodologies to prevent cognitive decline, and their Neuro Academy, which is a membership-based online community, which includes on-demand courses, live weekly cooking sessions led by Ayesha, live weekly coaching sessions and Q&As led by both of them, book clubs, a community portal, expert guests, all kinds of things, and they offer CE or CME credits for the courses as well. You can subscribe to their newsletter from their website as well, which has weekly recipes, brain teasers, neuroscience facts, podcast updates, and more. It's all free as well. And they're definitely proponents of Blue Zone type living, healthy whole food plant-based eating, but their focus is on brain health and Alzheimer's prevention and things like that. So I'm going to share those that I think are interesting and relevant and that you'll enjoy. They may not necessarily be about plant-based eating or vegan living, but if you're a subscriber to this podcast, I imagine you're interested in a healthy lifestyle overall. So I think you'll appreciate the blog posts I share from Ayesha and Dean Sherzai. They often talk about the importance of behavior change in health and wellness. It's definitely a common thread in many of their blog posts and podcasts. So today's post is about the importance of behavior change in health and wellness, and then tune in tomorrow for a real-life example where they share strategies for how we can actually keep any New Year's resolutions we may have made. So now let's get to today's plant-based briefing. The Overlooked Importance of Behavior Change in Health and Wellness by Dean Sherzai, MD at thebraindocs.com. In the realms of health and wellness, there's no shortage of conferences, seminars, and workshops about the benefits of certain foods, the efficacy of various exercise regimens, or the latest techniques in stress management. While these topics are undeniably important, there's a glaring omission in these discussions: the critical role of behavior change. Year after year, we see a pattern. The focus remains on the what to eat, what exercises to do, what relaxation techniques to adopt. But the how to integrate these practices into daily life, how to motivate individuals to adopt and maintain these behaviors is often sidelined. This oversight is not just a gap in discourse, it's a significant barrier to achieving real, sustainable brain and overall health outcomes. Understanding the individual, family, and community. Every individual is unique, shaped by a myriad of factors, including their family dynamics, community influences, cultural background, and personal experiences. To make a genuine difference in someone's life, it's imperative to understand these nuances. It's not enough to prescribe a one-size-fits-all solution. We need to tailor interventions to fit the individual's needs, resources, limitations, and opportunities. As I said on a related episode of our Brain Health Revolution podcast, linked here, an individual is never an individual. We're being influenced by our community, the resources in that community, the limitations in that community. For instance, recommending a 30-minute walk might sound simple, but for a single mother juggling multiple jobs or for someone living in a neighborhood without safe walking paths, this advice is not just impractical, it's tone-deaf. By understanding the individual's context, we can offer solutions that are both feasible and effective. That's the kind of powerful, tailored change we've been able to achieve through our Neuro Academy community. By designing this online space to be an open forum where people can find others with similar circumstances to theirs, answers to situational health qualms can be discovered organically and conversationally. The first step to understanding is listening. True understanding begins with listening. It's about creating a space where individuals and communities can voice their concerns, share their challenges, and express their needs. Only by actively listening can we hope to design interventions that resonate with everyone. However, the act of listening goes beyond mere passive reception. It's about empathy, validation, and building trust. It's about recognizing that the individual or community is the expert of their own experience. And it's about acknowledging that, while academic knowledge is valuable, lived experiences offer insights that no textbook or research paper can provide. Bridging the gap, the challenge of communication. So, if behavior change is so crucial, and if understanding and listening are the keys to effective intervention, why aren't these approaches more widespread? The answer lies in the challenging gap between the academic realm and the community. Research, including my own dissertation, has repeatedly shown the effectiveness of community-based interventions that prioritize behavior change. Yet, translating these findings into real-world applications is no easy feat. Academia and communities often operate in silos, with distinct languages, priorities, and approaches. Bridging this divide requires effort, patience, and a willingness to step outside one's comfort zone. But the rewards of this endeavor are well worth the effort. By fostering genuine partnerships between researchers and communities, we can co-create solutions that are not only evidence-based, but also culturally sensitive, contextually relevant, and deeply impactful. In the pursuit of health and wellness, it's time to shift the spotlight. Let's move beyond the endless debates about the best foods or the most effective exercises. Let's focus on what truly matters, understanding and influencing behavior. By prioritizing behavior change, by seeking to understand the individual and the community, and by bridging the communication gap between academia and the community, we can pave the way for a healthier, happier future for all. You just listened to The Overlooked Importance of Behavior Change in Health and Wellness by Dr. Dean Sherzai at thebraindocs.com. And I'm your host, Marian Erickson. Ayesha and Dean do such amazing work with communities and with their Neuro Academy. It also hits home for me that there are so many communities that I already belong to that I maybe don't leverage well enough. And that might be the same for you, I don't know, but I'm in a lot of online communities and Facebook groups and things like that for, exercise, for whole food plant-based eating, batch cooking clubs, even vegan support groups, Vistopia support groups. So when we're part of these groups, these communities, we are helping each other. We are supporting each other. We're supporting each other's behavior change to achieve our health and wellness goals. So please share this episode with anyone who might benefit, and thanks for listening.